Welcome to the Creating Health Show. I'm Dr. David Haase.
Many people ask me, well, how did you get into this field in the first place? And so I started out as a medical doctor, trained at Vanderbilt University School of Medicine. And then I went and did my residency at the Mayo Clinic in Rochester, Minnesota. And there I loved what I got to do. I mean, I really enjoy medicine, love taking care of patients, was amazed by this remarkable network of specialists and technologies to help us investigate disease and do a better job of treating people and getting to a real answer for people. And at the same time, I was encountering what was happening in medical literature, and that was the evidence-based medicine movement. And this is where, because of the advent of the internet, us doctors actually started to have access to the medical literature directly, where it wasn't so hard to go, we didn't have to go sort through the whole medical library. We didn't have to wait for things to come out into textbooks. We actually got to see, more of us got to see the articles as they came out. And with that became this great understanding that, wow, there's a lot hidden in this information. So how can we better learn how to read the medical literature and understand what is actually there? And so I helped start the Evidence-Based Medicine Club at the Mayo Clinic, and we got together a bunch of residents and a fellow in the bioinformatics department. I don't think it was even called that back then. It was just statistics. We started to look at about 3 different articles a month for several months. And it was an amazing process, learning like what statistics meant, what's the difference between absolute effect and relative effect, what p-values really meant, what's the difference between something being clinically significant and statistically significant. There's a whole bunch of really important information buried in medical literature. But I became quite despondent, actually, because many of the conclusions we came to were that these studies that we were basing many medical decisions upon had very little for legs. There were conclusions that were in that medical literature that didn't seem to trickle out into clinical practice and actually completely argued against what we were doing in practice. I do remember reviewing an early article about the medication Vioxx, and Vioxx was the latest and greatest anti-inflammatory that was going to protect all of the GI tracts from getting ulcers and decrease inflammation body-wide, and was going to save lives by decreasing how many people would get stomach ulcers from things like ibuprofen and naproxen. And in that article, it was clear that there were excess cardiac deaths. And that came out, and we discussed it as a group of physicians, and many of us questioned the use and prescribing of that. And I, frankly, never prescribed that medication after that time. But instead, that went on to become a blockbuster, multi-billion drug, and only to get pulled from the market several years later when the number of deaths had racked up over the 100,000 mark. And so within the medical literature exists secrets, exists information that we can apply, but it takes a lot of work to find it. And I became despondent, really, that so much of the medical literature was not supporting the type of treatment that we were providing. And at the same time, I saw people getting better. And I started to wonder, were people getting better despite what we're doing? and this is what really pushed me into this idea that, wow, we're here witnessing people's bodies creating health. And my job as a physician is to better understand that person and the barriers that are impairing their body's ability to heal, and to supply them with whatever is necessary for their body to heal or remove whatever barrier is necessary. And so there was a time I was even thinking about leaving medicine. And because I was so frustrated with this divorce in between the data that was present and our actual practice. And I remember going to a conference and hearing Dr. Jeffrey Bland speak. And he spoke of systems biology. And at that time, the term systems medicine hadn't even come around yet. But the idea in biology that everything was connected, that all things interplay. The immune system interplays with the gastrointestinal system, and the mitochondrial function interplay with the body's ability to remove toxins, and that affects the hormones, and then all of that together affects the structure, and I mean, everything was connected. And it seems so obvious, but that's not the way we're trained as physicians. We're trained to make diagnoses, to put things into a box, to label a diagnosis with a diagnostic code, and then from that code you have a number of treatment options that are given. And that is really what we say a reductionist model of healthcare. Let's name the disease, let's blame the disease for what's happening, and then let's tame that disease with some kind of an inhibitor, a blocker, or maybe stimulate the body, stimulate part of the system. But let's control the body as opposed to seek to understand and influence the body and enable the creation of health. So that was really the start of my journey, why I still love all of my colleague medical specialties. I think that there's a lot of great good that we do as a community, and why we seek to really increase our understanding of the individual person within our practice, diving deep into their understanding of what makes them tick and what's messing with their clock. So that was a little bit of how I got into this systems medicine, how Maxwell systems medicine started to come to be, and how it's, I'll have more to say about how we grew over the course of years and continue to change. So until next time, it's Dr. David Haase, be Maxwell.